My name is Melissa Druskis. I am coming to you with ABC Behavior Training to talk to you about the only parent assessment in the field of ABA, the Parent Assessment of Behavioral Concepts, also known as the PABC. So if you're not familiar with ABC behavior training, our goal is disseminating the science of ABA to everyday behavior analysts. That means coming to you where you are with whatever it is that you're working with to provide you with the tools, resources, and education to do your job confidently and competently. We do this through our resources, which includes experience hour trackers, competency assessments, supervisory evaluations, graphing templates, supervision curriculum book set, which is also an online version of that supervision curriculum, BCBA planners, and productivity tools. And we are always creating new ways to come to you to provide these resources to you that are going to help you in your everyday work as a BCBA. We also do this through education. So we offer CEUs, masterclass workshops, and intensive competency workshops, which are different levels of intensities of CEUs. Some of them are basic, just giving you information. Our masterclass workshops include a lot of tools that you can then take and apply these skills. And our intensive competency workshops goes even further than that by giving you the tools, the education, and also the mentorship, live one-to-one mentorship that you need to take these skills and apply it to your work. I also offer individualized one-to-one consultation and supervisor mentorship if you're out there as a new supervisor trying to get into providing supervision. We also have podcasts which have availability for CEUs, articles, and provide business consultation. And then we also provide supervision. So this is for students earning their fieldwork hours. We use a structured curriculum. There are many opportunities for unrestricted hours. They're able to learn from a varied team of experienced BCBAs. We also have group supervision opportunities. And if you want to find out more, you can either visit us at ABC Behavior Training or our new sister company, which will be taking over the supervision, which is ACE the BCBA exam. And if you go to that website or follow on Facebook, you can find some free study resources. So just a quick disclosure, some of the materials discussed in this presentation are sold by the presenter for profit. There is no obligation to purchase these tools, and this presentation is not for the purpose of selling any resources mentioned. Now, this CEU in particular is going over a tool that you likely will have or are interested in purchasing, which is the Parent Assessment of Behavioral Concepts. That is pretty exclusively what we'll be going over in the CEU. There's not really a lot of information. There's some that just generally pertain to parent training, but without that assessment booklet, some of this information might not be really relevant. So this CEU is pretty specific to that. So maybe you either already have that assessment booklet or it's something that you're interested in getting and you wanted to learn more about it. So just to give you a little bit of information on myself, again, my name is Melissa Druskis. I'm the founder and CEO of ABC Behavior Training and a BCBA. I have a background in speech language pathology and audiology with a bachelor's from University of Texas at Dallas. I have a master's degree in applied cognition and neuroscience, also from UTD, and I completed the graduate certification program in ABA from Florida Institute of Technology. My experience, I have over 10 years of clinical experience. I have experience with BCBA mentorship and ABA clinical consultation, graduate level teaching experience, as well as over 7 years experience in remote supervision. I'm the creator of ABC Behavior Training, and I'm also the founder and editor-in-chief of Behavior Brain Magazine, which is a new magazine that just came out this year in 2024 that goes over everything that's really related to behavior analysis and brings in other views as well from education, psychology, neuroscience, really ties everything in to ABA, really relevant for behavior analysts. Some of the publications that we have aside from the Parent Assessment of Behavioral Concepts includes the Behavior Analyst Supervision Curriculum. This is online and there's also a physical version of it. but it is a complete full supervision curriculum. It has all the materials, the assignments, the assessments to look at conceptual knowledge, applied skills, grading rubrics for the work they're doing with their clients. And then there's also a supervisor guide to give you all the correct answers and teaching tips along the way. So it's really the full package for providing supervision. We also have a behavior analyst planner. There's a physical version of that, as well as now a new digital version. And this planner is really going to give you everything that you need as a behavior analyst to plan your day. It's not just a normal planner. Of course, it has those features in there, but it also has things like client summary sheets, so you can be tracking client information over the month, tech evaluations, looking at your own personal and professional goals, burnout check-ins. There's so much in here that is very specific to BCBAs, so it goes well beyond just a normal planner. There's also session notebooks, so you can keep track of your sessions for your clients in physical form if you like to do that. And then, of course, we have the PABC and then the Behavior Brain magazine articles. So today we are really going to be doing a deep dive into the PABC. I'm going to start off with an introduction, then we'll look at the administration of the assessment, go over an in-depth content review, look at how to score the PABC, we'll look at goal guide, report writing, and then after the assessment. So to start with, let's go over an introduction of what the parent assessment of behavioral concepts is. So this is the only standardized assessment for parents in the field of ABA, at least as of 2023 and 2024. Now, currently, there is not another parent assessment that is like this for our field. It's going to assess the conceptual knowledge and the applied skills of parents and caregivers with children receiving ABA services. It's going to cover 9 domains. It includes 107 criterion-referenced assessment items, and then each assessment item is tied to 1 to 2 goals for a total of 164 pre-written parent goals, which I know some of you are seeing that and it's like, I'm struggling to come up with like 5 for, a parent that's been in ABA for a while. So this is really going to help you with that. You have so much information that you can work with in guiding parents through this process. And it's going to cover basic and advanced skills. It also should cover parent training topics throughout the child's entire ABA therapy. So the purpose of this, it was developed to fill a need to have a structured assessment to evaluate parents' skills in ABA-related concepts, to track their progress, and create meaningful goals based on their areas of deficit and social significance. So remember, guys, I'm a BCBA. I'm out there working in the field, and I typically create goal banks. So I had quite a few parent goals of a goal bank, but come time for reevaluation, when you're having to deal with insurance companies, they're always looking for, okay, well, like how are you demonstrating this? How are parents participating? And there's such that strong push towards getting parents to take over ABA services, which does make sense. We can't be there forever and we do need to generalize these skills, but we really had no way to track it. And I looked around before taking this task to create this assessment, and there was really nothing. There are parent training curriculums. That's definitely true. There's lots of different parent training curriculums out there that you can utilize, but no way to actually assess their skills and see what they need. If you're using one of those curriculums, a lot of times you're starting at the first page and just going through the book, talking about these different concepts, but it wasn't really individualized, and there was really no way to demonstrate where the parent's skills are and how they're making progress and participating through each evaluation period. So really, we needed something for that. And that is what led to the development of the PABC. So parent training without the PABC, it's informal. It is subjective, not really based on data, not individualized. There's really no formal training or competency measures. And oftentimes it's conducted by winging it. And maybe you have your own very specific parent training system that you use, and that's fantastic. But especially as a new BCBA, when I entered the field, I did not know what I was doing in parent training. I didn't like parent training because I wasn't comfortable with doing it. And I certainly fell into this category here of I just felt like I was going in there and winging it sometimes, or I was just talking about progress and not having a clear path of how to train the parents in these goals that I wanted them to carry over. Because training and programming for a client, we have those skills, but it's not always intuitive to transfer those skills of working with a child with autism to training a typical adult on these concepts that we're trying to teach. So parent training, it often comes from information that you gather from the parent interview, either from a predetermined curriculum, a pre-written goal bank, or just informal observation. So there's not really anything very concrete and objective that we're basing our parent training on. Now, why is this a problem? Or why does this really occur, actually? Where does this start? As I was talking about, BCBAs often don't have the training to provide effective and high quality parent training. We just don't. It's not in our school curriculum. Hopefully you get that training when you're in supervision for your field work hours, but many times people don't get that experience, and you don't have that very strong background to transfer these skills to training our parents. The tools and resources we have are step-by-step curriculums. They're not individualized, or they are using no resources at all. You're just going in there and talking to the parent and hoping some of it sticks. And the focus is on the client's skills and their progress, which is important, but the parent is our client too, and insurance will require them to take over services at some point. If you can imagine, when kids turn into teenagers, it's really hard to get those hours, and you're definitely not getting 40 hours a week, at least if you are. Please let me know how you're doing it, because that's very difficult, at least here in Texas with private insurance. So we really need parents to become competent in this. We need parents to basically become RBTs so they can take these things over, but instead of a general way, it needs to be specific to what their child is doing. So now parent training with ABC, with this new assessment, it is objective. It is data-based decisions is what you'll be utilizing. It identifies gaps in parent knowledge and skill. It provides a plan to target areas of deficit. It tracks progress over time. You can target advanced skills, which are often lacking for experienced parents. I know sometimes those have been the most difficult parents to do parent training with, is some of the ones that have been in ABA for years. They know all the basic stuff that we're all used to writing parent goals for. So what do you do with them then? They're 5 years into it. They understand what ABA is. They know the functions of behavior and prompting and reinforcement. What do we do with those parents? And this is going to help with that. It also can be carried over to different companies and settings. So you do the PABC. Ideally, if we have more and more people utilizing this assessment, just like our client having the VB map or AFLS or PEAK or whatever assessment it is you're utilizing with them, they go to a new provider because they move, or they just had to make changes, whatever it is. This can be carried over, or you get a new client and you can quickly see where they're at based off of their previous reports, and then you do your assessment to get them started. Well, we've never had anything like that for parents, but now with the PABC we do. So it offers specific topics of discussion for parent interviews. You actually have something you're going to go over. Standard criterion-referenced assessment items, goals that are tied to areas of deficit, where you're no longer trying to pull these goals out of the air to create something meaningful for our parents. And it also has structured observation items, so you actually know what it is you're looking for while you're observing the parent with their child. So the content, like I said, it has 9 domains, which are based on skills that are relevant to those implementing behavior analytic programs based on the BACB task list, 5th edition, which again is still going to be relevant to the 6th edition test content that's coming out for 2025. So all of the same skills that we need to have as BCBAs is still the same. It's just now adjusted for the 6th edition, reworded, and a few things added to it. So still relevant to that. Also based off of BACB coursework requirement for BCBAs and through extensive parent training experience from in-home and clinic-based ABA programs. So really, I took a look at all of this and created these domains based off of what parents need to know. Again, I said it's like we want our parents to become RBTs, but it needs to be specific for their child. So it's good to look at all the knowledge that we know, put this into an assessment that we can now individualize and tweak it to make sure it's relevant for each individual parent that we're working with. So these 9 domains include autism, applied behavior analysis, skill acquisition concepts, daily living skills, verbal behavior, social skills, behavior reduction, behavior intervention, and parent behavior. So the rationale for using this assessment, sure, you could go on continuing to use nothing or just using a non-individualized curriculum, but we're really missing out on so much information without using some sort of structured assessment. So if you're a clinician, you know that working with children with autism or any children, other developmental delays or anything else, you understand that the work is not done when the client leaves the clinic or when the therapist leaves the client's home. That is only a piece of it. Not only is parent involvement in ABA therapy required by most funding sources, but it's well-documented, evidence-based intervention that leads to improved outcomes for our clients. So despite this need, an industry standard method for assessing parent skills and knowledge related to behavioral concepts has yet to be available. There is nothing else that is looking at this. So the PABC addresses this gap by providing professionals with a criterion-referenced assessment of concepts and skills that parents and caregivers may need to carry over the therapy procedures to their natural environment. So some limitations of the PABC. This may not be an exhaustive list of all skills that the parent or caregiver may need. Now we go over a lot of stuff, but there's always unique cases and maybe there's something you need the parent to know or understand that's not covered here. But that's okay. This is still going to cover at least 99% of what it is that you need to work on. And if you need to add something additional, you always can. Some of the skills included may also not be relevant to the client's current needs and therefore may not be needed in parent training. Like I said, this is a very thorough assessment. If you have somebody that is brand new to ABA, they're not going to need to know all of those things right now. If you have a client that is vocal verbal, then they don't need the information that's covering AAC devices. So you have all the things that you need, and you can just adjust and not assess for some of the things that are not relevant to the client's current needs. The assessment and tools contained in the PABC provide the map of where the deficits are and the destination of what the ultimate goal should be, but not the path of how to teach the targeted skills. However, I think this is also a benefit to the PABC because it allows flexibility for it to be utilized with any existing parent training curriculum or methods currently being used. Maybe the clinic or company that you're at specifically uses one parent training curriculum across the board with all of their parents. That's great. You do not have to stop using it. You're just going to use the PABC to assess their skills, figure out which areas you need to work on for which parents, and track their progress over time. You can still use your curriculum, you can still use whatever methods it is you're using, or you can take this PABC if you are not using anything, and you can expand on it to cover these areas more in depth and more specifically. Also, the assessment results are not functional without an experienced clinical judgment to make the decisions on goal selection, goal order, and training methods. So your clinical judgment is definitely an important piece when it comes to utilizing the PABC. Now let's take a look at administration of the PABC. Who can administer it, how it should be administered, item selection, and language that we should be using. So who is qualified to utilize the PABC? Of course, BCBAs or BCBADs. Also, BCABAs with oversight from an experienced BCBA, and also other professionals experienced in behavior analysts, such as psychologists. This should not be used by an RBT unless they are also getting their fieldwork hours towards supervision to become a BCBA, and again, they are doing it with supervision from the BCBA. So how is this going to be administered? The assessment includes items that evaluate the parent's conceptual knowledge and or applied skills. Some it's both, some it's just one. The conceptual knowledge can be assessed through discussions, direct questions, comprehension questions, and examples. Applied skills can be assessed through directly observing this in the natural environment, directly observing it through contrived events that you create, and also with role playing with the client if that's appropriate, or with other individuals to see if they can actually apply these skills. Now, if the parent does not demonstrate an understanding of the conceptual knowledge, you should not assess their applied skills, because the conceptual knowledge is the foundation of correct implementation. I do the same thing in supervision. If you cannot show me your conceptual knowledge of a preference assessment and talk to me about it and how to utilize it, I'm not going to ask you to go out there and do it with a client, because then we're just setting somebody up to not do a great job at a new skill. So we want to make sure they have that conceptual knowledge first, and then we can go and look and see if they can apply it. Also, this assessment should never be handed to a parent to be used as a self-report questionnaire. It is written and designed to be administered by a qualified behavior analytic professional. And as we go over some of the questions, you will understand why. If you hand this booklet to a parent and ask them to fill it out, they're going to be freaked out. There's a lot of content in there that's not going to be relevant for every single parent. And it's also written in the language for behavior analysts, not for parents. So we don't want to set them up, giving them a questionnaire of stuff that they don't understand what it is. We want to make sure that we're the ones asking the questions or directly observing these skills. So for item selection, only advanced and experienced parents should be evaluated using the entire PABC. Experienced parents, meaning those that have been in ABA for a while. They understand all the basics, or it's somebody that you've slowly worked through the whole assessment with. You're not going to have a brand new parent and go through the entire PABC, because all you're going to get is a lot of zeros and a parent feeling like they don't know anything, when that's not true. We just want to start small and build upon skills that are most important, and then slowly go through the rest. So at some point, the parent should eventually contact all the items in the assessment, but that should not be the starting point. And initial administrations for new clients should focus on foundational concepts and those that are highly important to the client's treatment. So the following that I'm going to go over here with you, these are examples and they're based on my opinion. You should make your own item selections based on your client and parents' needs and your clinical judgment. You do not have to follow this example specifically. But what I do typically, and again, this is generalization, when I have a parent that's new to ABA services and autism, these are the several areas that I go through. So as you can see, this is a handful of test items compared to the 107 of the entire assessment. So you do not have to use the entire thing with the parent right away. So items that I typically go over in the autism domain, I'll go over what is autism, diagnostic criteria and causes of autism. When we're looking at behavior analysis domain, I look at what is ABA, understanding their behavioral team and who to go to for what. Also, what is behavior? What does that mean? Because we'll be talking about that a lot. I also go over positive reinforcement and following instructions because that's one of the key areas. Oftentimes we need parents to follow through and understand how to do that. And then when we're looking at parent behavior, I almost always will include parental burnout so they can understand that and have methods for following up on that with themselves and checking in with themselves, because it's very easy for parents to become burnt out. And then also networking and support. So this is an example of what I might do when I have a parent that's new to ABA, but again, you use your own judgment, but it might be good for you to go through the assessment and identify which things you are generally going to start with when you have a new parent, and then make adjustments for each child individually. Maybe you're going to, if a client has challenging behaviors, you might also add in some items from the behavior reduction domains. If they are nonverbal and you're going to pretty heavily be working on increasing their vocal behavior or verbal behavior, if it's an AAC device, you might want to be looking at some items from the verbal behavior domain, and also maybe some more items on prompting and shaping from the skill acquisition concepts domain. Maybe for an older client, you might have an initial focus on including more items from daily living skills, and clients that are, you might say are high functioning, might start with more items from the social skills section. So this is where you're going to individualize it. Item selection should remain flexible and individualized to each family's need. There is no one right answer of where to start, other than don't do the entire assessment for a brand new family to ABA. Otherwise, you can pick and choose what things are most important that you want to assess their skills, and then build from there. And then language. So when I'm talking about language, I am talking about our technical jargon. There are many studies that show that using technical jargon is perceived as harsh, abrasive, difficult to understand, and awkward sounding to the general public. So technical terms should be avoided. However, the PABC is written for behavior analysts, and it does use technical language because I want to avoid confusion and misinterpretation of its content. But you should not be directly reading this to the parents because we want to avoid technical jargon. So all items should be presented to parents using everyday language that's within their understanding. But again, it's written in technical jargon so that you understand it and there is no misconceptions across our field through different behavior analysts that are utilizing this assessment and implementing it. So as parents become more competent with the areas that are being taught, you can start introducing more technical language because they'll start learning it. But only do so whenever it's relevant and if it's applicable to the parent. Maybe if you tell them reinforcement and you've taught them what that is, you may still want to use phrasing such as like reward because they're not used to using reinforcement in their everyday language. So utilize however is going to be best for the parent to understand what it is that you're asking them. So here are some examples of using everyday language. So for autism domain, item number 3, a diagnostic criteria social communication, persistent deficits in social communication, including but not limited to verbal and nonverbal communication, back and forth conversation, body language, and facial expressions. So in the parent interview question, you might just ask them, tell me about your understanding of how autism impacts the conversation skills and body language of your child. And then when you're training on this discussion topic, you may say something like, one of the areas that autism can affect is your child's communication skills with others. This includes the words they use, how they sound, and their body language and facial expressions when they're talking to somebody. So that is a lot more user-friendly of language than the actual criteria here, where we're talking about verbal, nonverbal, and all of that. We're making it sound easier to understand with clear examples of what we're talking about as we're talking to the parent. Another example could be a behavior analysis domain, item number 8. What is behavior? So this one says any action that is observable and measurable. This includes private behaviors that can only be observed or measured by the individual engaged in the behaviors. So your parent interview question might be, when I say behavior, what does that mean to you? What would you consider an example of behavior? Now that is very simple language. You don't have to ask them to define behavior. You don't have to make sure they use the key terms observable and measurable. We just want to know, what does it mean to them? And the parent may initially only be thinking about good behavior or bad behavior, or the idea of behaving. Training discussion of the topic, we might say something like, when we're talking about behavior, that just means what someone is doing. This includes things you can see, like someone walking or doing homework or watching TV, yelling or throwing a ball, and things that you can't see, like someone doing their math in their head, thinking about what they'll cook for dinner, or feeling sad. So again, we are explaining to them in everyday language what behavior is, not using the terms public and private behaviors, observable and measurable. We're making sure it is in terms that the parent can understand regardless of their education level and background in ABA. And then another example is discrimination. This is from skill acquisition domain, item 9, which states the ability to identify one stimulus from other stimuli based on the instruction or information provided. So you might do, in this example, a role play question. Can you show me how you would get your child to find one item from a group of several items, which easy to understand. We don't have to use the term discrimination in that. And then training discussion of the topic. When we're working to increase our child's vocabulary and knowledge, one way to teach and assess it is through discrimination. This is when the child has several items or pictures in front of them, and we ask them to find one item by its name, description, or other information we give them. If they can do this correctly, it shows us that they understand that the words we say match with the item they selected. We use this every day by finding things around our house or getting items from the store off of our grocery list, but instead of there being just a few extra items to choose from, we are discriminating from everything around us. So that is a very good description and example of discrimination without making it too complex or using too much technical jargon. And then another example, behavior intervention domain item 4, extinction procedure for escape. So escape maintained behavior occurs. We're going to continue instruction during the problem behavior until the task is completed, use prompt hierarchy or wait it out, block access to other items or activities until the task is compliant, and restate the demand neutrally and not more than once per minute in most cases. So role play question, can you show me what you would do when your child is doing something off task to get out of what they should be doing or what you ask them to do? So again, clear example, we're not using terms escape, extinction, or anything like that. And then a training discussion of the topic. When the client is not following our instructions or completing a task and they have not used the appropriate skills we're working on, such as their replacement behaviors, first restate the instruction so they know what they should be doing. Then you can either wait for them to get back on task or help them with the task using the strategies we've talked about, which would be whatever those client-specific prompts are. Make sure you stay neutral during this time. Don't let them switch to any fun activities until they're done. So all of those are just a few examples of how we can take technical terms specifically from this assessment, but you can also utilize that in your parent training going forward and translating them into everyday language. Now, when we do this, especially if you're not used to it, it might make us feel awkward, uncomfortable. It feels imprecise. It feels incorrect. I know reinforcement is not the same as reward, but it is to a parent. We can simplify it and we can take that hit to our vocabulary ego and switch up our language to make it easy to understand for parents, even though it feels incorrect to us. And it can also feel mentalistic. We know that's not how the behaviors are working, but again, it's how we are trying to explain it to parents so that they understand and they feel comfortable. It is more important to keep our clients and parents on board with our treatment plan and comfortable with us and how we are engaging with them than for us to feel uncomfortable with using everyday terms. So practice using everyday language. Plan what you're going to say ahead of time and how you're going to adjust your language. And it may even be helpful if you make a cheat sheet to refer back to, especially for some of those technical terms that we're used to saying every day, but parents are not necessarily going to understand, especially if they're new to ABA. The next section I want to go over is the content review. So you have seen little snippets of the assessment as we've been talking so far, but now I want to go a little bit more in depth on what's going to be covered in each of the different domains. So the first domain is autism, which is abbreviated AU. This section is going to cover the basics of autism, including diagnostic criteria and treatment. The scoring focus here should be on understanding concepts and applying their relevance to their client. So we are looking at what is autism? Do they understand what autism is? Maybe this could be a brand new diagnosis for their child and they've not experienced having other children with autism in their family. So we want to make sure they understand what it is and how it applies to their child. We also want them to understand the diagnostic criteria, the different areas of potential deficits, and how this applies to their child, and also how that's going to relate to our treatment plan and us working with their child. I think it's also important to go over the causes of autism. There is a lot of misinformation out there, which can then lead to some issues when it comes to avoiding or seeking out things, or even what sorts of treatment they are going to utilize. So understanding the causes of autism, I think, is really important for parents to understand where it came from. Also, some people may feel like it's their fault that they did something that caused the autism. Maybe they were really stressed out while they were pregnant, or like people used to think they stood too close to the microwave, and of course those things are not based in reality. So we want to let them know what is like the history of autism, what causes autism. It is not their fault. It's not vaccines, so they can get a good understanding of where it came from. And then also evidence-based treatment. So parents should be able to start using some judgment based on science of what treatments are going to be effective for their child. And the best that we can do is give the parents the knowledge and ways that they can, scientifically assess all of these things that are going to be thrown at them. There are so many things out there that claim to cure autism or to just diminish the symptoms. And we of course have evidence-based treatment, which is what parents should be pursuing. There are some things out there that are just going to obviously do nothing to help their child except cost the parents lots of money. And sometimes there's things out there that are actually going to be harmful, like chelation therapy. That is not evidence-based, and I have heard a parent that did it with her child, and she had breast cancer previously and said that it was worse than chemo. So that's obviously really traumatic and harmful for a child to go through, and it's not going to cure their autism. So going over those things too, and giving parents a way to have that, effective judgment of all of these treatments that they're going to be hearing of on Facebook and seeing on the news sometimes, or hearing about from their friends, and have them be able to make good judgment based off of what is evidence-based treatment, knowing what that is, what that's not, and even how they could do the research to find that information. The next section is Applied Behavior Analysis, which is abbreviated BA. This section is going to cover the basics of ABA, the behavioral team, and foundational skills. So scoring focus here is going to be understanding the concepts with some client-specific implementation. So here we're going to be looking at what is ABA, what are the dimensions of ABA, the BACB, our ethics code, who is in their behavioral team. So that we're going to be looking at RBT and BCBA, and if you have BCABA, you can throw that in there as well. ABA program expectations, what is behavior? Then we're also going to look at some basic items of data collection, including continuous measurement methods, discontinuous measurement methods, and interpreting data. So just getting parents some of this basic information, because again, at some point we'll want them to take some data. We'll want them to understand the data that we are taking, even though we can explain it to them. But this is a really good time to carry over some of these very basic skills to the parents to give them some ability to start doing some of this outside of our therapy sessions. Next, we have skill acquisition concepts, which is abbreviated SA. This section covers the procedures and concepts relevant to increasing behaviors in skill acquisition. So our scoring focus here is going to be understanding the concepts and applying them with the client. So this is when we get much heavier onto actual application of these skills with the client, because we want them to be able to utilize these when appropriate outside of therapy. So here we're going to talk about goal prioritization, positive reinforcement, negative reinforcement, automatic reinforcement, socially mediated reinforcement, prompt hierarchy, utilization of a token system, visual schedule, response effort, discrimination, generalization, following instructions, using guided compliance, establishing instructional control, error correction, natural environment training, and discrete trial training. Our next section is daily living skills, which is abbreviated by DL. This section covers the procedures used to teach daily living skills, as well as parents' ability to implement them for various tasks. So our scoring focus here is going to be understanding the procedures and using them to guide the client through a set number of tasks per section. So we'll be looking at shaping, task analysis, chaining, and then for skills, we're looking at feeding, dressing, bathing, grooming and hygiene, household tasks, and toileting. Verbal behavior is our next section, abbreviated VB. This section covers the different verbal operants as well as the training procedures for each operant. So our scoring focus here is understanding the verbal operants and how to increase and expand verbal skills. We'll be talking about motivating operations, MANs, tacts, echoics, interverbals, listener responding, PECs, and other AAC devices. Our section SS is going to be for social skills. So this section is going to review the necessary social skills at beginner and advanced levels. So understanding the concepts and being able to demonstrate training them in the natural environment is going to be the focus when it comes to scoring these items. We will be looking at joint attention, developmental play, language expansion, novel games, familiar games, greetings, nonverbal conversation skills, verbal conversation skills, and perspective taking. Behavior reduction is going to be our first behavioral related domain, abbreviated BR. This section assesses the concepts related to reducing challenging behavior. So here we are mostly focused on understanding the concepts and applying them to the client's current therapy. And in the next section that we'll talk about, that is much more related to actually implementing the behavior plan. This part is a lot more focused on understanding the concepts and how it relates to the client. So here we'll be talking about functional assessment, antecedents, consequences, ABC data, topography, function, other causes of challenging behavior, and punishment. Now, this is the second behavioral domain. BI is behavior intervention. This part is going to look at the hands-on skills of applying the relevant behavior interventions with the client in the natural environment. So here we're going to be looking at demonstrating the application of the relevant procedures with the client. So we'll be going over antecedent interventions, differential reinforcement, replacement behavior, extinction, side effects of extinction, behavioral contract, rule-governed behavior, and behavior management strategies. And then in our final domain, which is parent behavior, also abbreviated as PB, this section is going to cover the behavior of the parent and how that may impact therapy. So this section is going to have a scoring focus to understand the effects of each topic and demonstrate the desired behaviors for each item. So first one is going to be parent training attendance. We'll also talk about negative reinforcement and avoidance, again, related to the parent. So how the parent is negatively reinforced or engages in avoidance behaviors of sometimes implementing these things we're working on. We'll talk about parental burnout, self-care, access to the community, networking and support, and mentalisms and false antecedents. So that is an in-depth look of all the domains that are covered in the parent assessment of behavioral concepts, those 9 domains, which should really give you enough information to be able to assess and program for parent training from the start as you have a brand new parent all the way to the end as you have a very experienced parent. They've been in ABA for years, maybe have a teenager at this point, and you still have the content and items that you can assess and go over with them at whatever level they're at. So now let's talk about scoring. I went over a little bit the scoring focus for each of the domains, but we're going to go over a little bit more in depth what that looks like. So scoring levels. Why is scoring important? Why do we even need this data? Well, for one, it's going to establish a baseline for skills. It allows us to track growth over time, and it highlights areas needing targeted intervention. You would not start working with a client without an assessment, without knowing where they're at, where the deficits are, and what it is you need to work on, as well as a way to track that over time. Yet with parents, we do it all the time. So this scoring is very important because it's going to give us that data and give us this backing to what it is that we're working on. So each item can have a score of 0, 1, or 2. This is general, but it is very clearly laid out for each item. But a score of 0 is basically going to mean they do not have any sufficient skills. They either lack the basic understanding or the ability to demonstrate the skill for that item. A score of 1 shows that they have conceptual or basic understanding. It demonstrates a foundational grasp of the concept, but they struggle with consistent application. And a score of 2 is applied mastery or advanced understanding. They're able to consistently apply the concept with proficiency and autonomy. That means they do not need to work on that anymore. They've mastered it, and you can move on to something else. So let's take a look at some of these examples of scoring levels. So for BA9, that area is data collection. It states precise and immediate data collection is the foundation for accurate decision making throughout the therapy process. Now going all the way over to the right, a score of 0 means they do not demonstrate understanding of the concept. They don't know anything about data collection. A score of 1 says that they demonstrate understanding of the importance of data collection, but not really how it applies to current therapy. So you've said that it's important, they know it's important, but they don't really know what it is you're doing when you're collecting data or how it's being used. Now, a score of 2, they demonstrate understanding of the importance of data collection and how data is collected in current therapy. So mastery here is going to focus on the conceptual understanding and how it applies to the client. Another example that is going to have mastery focused on conceptual understanding and actually utilizing it with the client is going to be BA10, which is continuous measurement methods, where we're looking at frequency, rate, duration, latency, inter-response time, percentage of occurrence, more accurate but requires constant observations. So a scoring of 0 here is that they cannot describe the methods of continuous measurement. A score of 1 says that they can describe the different methods, but they're unable to actually utilize it to measure behaviors and skills with the client. And a score of 2 states that they can describe the different methods and they can utilize client-specific data collection methods with an IOA of at least 80%. So this goes from no skill, conceptual skill, and then mastery is conceptual and applied skill. And then one final example, which is more related on the application of the skill with the client as opposed to the conceptual understanding, because that is targeted elsewhere as we're talking about shaping and chaining and prompting, is DL8, which is household task, that the client will be able to complete age-appropriate household tasks, such as vacuuming, cleaning their room, washing dishes, feeding pets, laundry, etc. So a score of 0 is that the parent does not understand how to use ABA procedures for this task, or they require prompting from the BCBA to complete them. A score of 1 is that they understand how to use the ABA procedures to guide a client through at least one age-appropriate household task without prompting from the BCBA. And a score of 2 is that they understand how to use ABA procedures to guide the client through at least 3 age-appropriate household tasks without prompting from the ABA. So here we're not really looking at that conceptual knowledge, we're just looking at that applied skill. Are they able to start doing this with an appropriate number of tasks for this client, moving from a score of 0 that they can't do it, 1 they can do it with at least 1 task, and 2 they can do it with at least 3 tasks. So when we're talking about skill tracking, that's also really important and something unique to the PABC that we just don't really do for parent training otherwise, is you are going to have access to the PABC grid to record scores for each assessed skill. So you're going to assign a unique color for each assessment to easily visualize changes over time. So kind of thinking about AFLs, ABLES type scoring grid. Assessment 1, you might use green, then you do it again, you use orange, you assess again, you use purple. Benefits of tracking with a grid: it provides a clear and visual representation of progress. It facilitates discussion with caregivers about strengths and areas of growth because you can actually see it on the graph, and it ensures continuous monitoring to guide interventions. So this is an example of what that might look like, where assessment 1, they have some skills. Assessment 2, you've added a few more. Assessment 3, some more. So typically how it's going to look is you're going to start, of course, bottom up. So 0 is going to be nothing is filled in. 1 is going to be that first one on the bottom is filled in. And then a 2 is the one above that is filled in. So as you can see on VB1, they had a score of 1 on the first assessment, and they obtained a score of 2 on the second assessment, so that one's now mastered. You may also find that progress is going to move from left to right, but it doesn't necessarily have to go in that order. It may go in a different order just depending on the things that you're working on and what's relevant and applicable to that client. So progress, like I just kind of talked about while looking at that grid, initial assessment is going to have a higher frequency of scores at 0, which says no sufficient skills. They could be completely new to ABA and autism and everything, and you might see all zeros, and that's okay. You're going to build upon these things slowly. You will eventually get them to where they need to go, but also if it's a new parent, they should not have that whole thing filled out, not even 2 years into the process. They're not getting 40 hours of therapy. They're getting at most usually 1 hour a week. So it's obviously going to be a slower progression than what we would see with our clients. Now, intermediate assessment, you're going to see a shift towards ones with that basic understanding with occasional twos. And then advanced assessment, this is going to be that parent that has been in ABA for years. They might have a majority of school scores at 2 with just a few things that they're working on. So the goal of progress tracking, we want to make sure that the skill development is in line with the intervention plan, but we are using data to celebrate milestones and motivate continued growth. I think seeing this visual for parent goals can be motivating for the parent as well. And it's going to help us identify persistent challenges to adapt to teaching strategies that are going to be more effective for the parents as needed. Maybe they're getting a lot of the conceptual type goals, but they are not getting a lot of the applied goals. Let's look back and see, are we actually teaching them? Are we using behavioral skills training to do like hands-on training to get them to have these applied skills? And now I want to talk about the goal guide. So we've looked at what the assessment looks like, everything that's contained in there, but the goals, I think, is one of the biggest benefits to using this assessment. So I want to go over what that looks like and what you're going to have access to here. So the assessment, as I said, provides 164 pre-written goals, each tailored to specific areas of deficit. Each skill area includes 1 to 2 goals designed to address the identified need. So post-assessment action steps. The first thing you'll want to do after you complete the assessment, you're going to need to go to the goals section. That's going to be at the end of the assessment booklet, and you're going to review the suggested goals tied to each area of deficit identified during the assessment. So like I said, if you have a new parent, they're going to have a lot of areas of deficit. You are not going to just copy all of those goals and put them in your treatment plan because the parent's going to get overwhelmed and you're not going to get through most of those. So the next step is to select your key goals. So look at these areas of deficit, look at the goals that are tied to them, but then let's figure out, what do you actually want to work on? Focus on, and this is what I typically do. You may set it up differently, but I typically focus on about 6 goals for a 6-month authorization period if conducting parent training 1 hour per week. You can do more than that. You can do less than that. If you do 1 hour of training per month, then I would probably do less goals because you want to make sure that this is something that's attainable, that with your time meeting with the parent that you can realistically work on these things and get some progress on them. So just base it off of what you do with your parent training, how you're going to implement this, and come up with a reasonable number of goals, which can be hard a little bit at the beginning because you now have so many things you want to work on, right? You have these new areas that you may not have been working on before, such as the parent behavior, but still just make sure that is something that's achievable for that authorization period. And then goal selection. You want to make sure the number of selected goals, like I said, is reasonable and achievable within the authorization period. Prioritize goals that will have the most significant impact on parent skills and outcome. If you have a client that is nonverbal and you're working on man training and you ask the parent what is their main goal that they want to see in the next 6 months, and it's that their child starts communicating with them in some way, then that should be a parent goal. You should be working on that versus like a daily living skill that the parent doesn't find as much meaning in because their child is like 4 or 5 and they already do a lot of the stuff for them. So figure out what is most socially significant for the family. And then also balance challenging areas with opportunities for easy and early success to maintain motivation and engagement. Don't make everything super hard, or don't make the goals like all of the most difficult things to work on. Put some goals in there so the parents can get some wins and feel motivated and feel encouraged to keep going. And then, of course, you want to individualize these goals as needed for each client and each parent. I think the goals are pretty well that you could just put them into your report as they are, but you are going to have situations where you need to individualize them. And if so, please do so. You don't have to keep these goals in there word for word as they're written. Now I want to look at goal writing and what that is going to look like for parents compared to clients. So for our goals, of course, the whole thing needs to be observable and measurable. When we're looking at clients, I'm going to go through a client example first. We need to have a clearly defined outcome. So for a client, that may look like that they will respond to their name by orienting their body towards the speaker. Clearly defined goal. Now we want to describe the conditions. So during neutral tasks without prompting or challenging behavior. Now we want to state the level of proficiency. So we know we want them to respond to their name by orienting their body to the speaker. That's what that's going to look like. It's really objective. We know what we're measuring. When they're going to do it, it's going to be during neutral tasks without prompting or challenging behavior. So not like while they're playing their favorite video game. The level of proficiency, what is the mastery criteria? What are we looking at here? We are looking for 8 out of 10 tries. And then the generalization criteria. When can we actually consider this mastered? We are looking for across 3 consecutive sessions with 2 individuals. Now, of course, you're still going to do generalization after that, make sure it's maintaining across time, but to have this goal mastered, that's what we're looking for. 8 out of 10 trials, the proficiency, across 3 consecutive sessions with 2 different individuals. Now that's for a client. Hopefully you are already familiar with writing goals like this, and that's what you're doing for your client goals. But it's going to look the same for parents. So clearly defined outcome. The parent will follow through on client's behavior of responding to their name. So this is the flip side of that client goal that we were just looking at. The client needs to respond to their name. The parent needs to know how to follow through on the client's behavior of responding to their name. Now the conditions, what is the environment? What should they be doing? They should be using least to most prompting. That's not you with the parent, that is the parent with the client. The parent should be using least to most prompting. And then the level of proficiency, we want to make sure that they can do this in 4 out of 5 naturalistic trials. And then generalization criteria across 3 consecutive parent training sessions. You'll see that the number of trials is less, but your client is getting hours of therapy each day. Your parent, you're getting probably 1 hour a week. So that's why those numbers are less, but you can adjust it as you need to for your clients and for your parents. Another thing that you may want to do is you might want to split up goals by mother and father instead of just saying parent, because it's likely that the child is responding differently to each person. And then we also want each person in the family, add aunt and grandma and whoever is like living there working with the client on a regular basis, babysitter, whoever it is, that we want them all to be accountable for the goals and that they are actually participating and making this progress. And also it's likely that the client is going to respond differently to these different individuals. Now, in goal writing, I'm not color coding them here, but they all still have the same criteria that we're looking at. So example here for the autism domain, does the parent understand evidence-based treatment? We're looking at this goal of a score of 2. Can they provide the definition of evidence-based treatment and list 3 effective and 3 ineffective or harmful treatments for ASD? So the goal for this area of deficit is that the parent will define evidence-based treatment and list 3 effective and 3 ineffective harmful treatments for ASD without prompting, with 80% accuracy across 3 consecutive parent training sessions. Another example, when we're looking at the domain applied behavior analysis and the area what is ABA. So a score of 2 here is that we're looking that they demonstrate an in-depth understanding of what ABA is and is not, and can identify how it's being used with the client. So here we're looking at parents will accurately describe the definition and use of applied behavior analysis without prompting, with 80% accuracy across 3 consecutive parent training sessions. And then another example, this one is going to actually have two goals tied with it because we are looking at two things. We're looking at conceptual understanding of negative reinforcement. So a score of 2 is they demonstrate in-depth understanding through discussion and answering questions, and that they can use the concept with the client. So this mastery score is looking at conceptual knowledge as well as applied knowledge, and that's why it has two different goals. So parent will describe and answer comprehension questions about negative reinforcement without prompting with 80% accuracy across 3 consecutive parent training sessions. And then the second one is that the parent will utilize negative reinforcement with the client without prompting in 4 out of 5 naturalistic trials across 3 consecutive parent training sessions. Now we're going to talk about data collection here in a minute, but I do want to point out the difference here that you have seen a few goals that use 80% accuracy, and now you've seen one that uses 4 out of 5 naturalistic trials. Well, when we're working with clients, we have the time. I always put a minimum number of trials. I almost always, I'm sure I could think of a few exceptions, utilize 4 out of 5 trials, 8 out of 10 trials, or whatever that is, because when you're comparing, I want to compare the same number all the time, right? I don't want one trial to be 100% and then they did 2 trials and the kid got one wrong, so it was 50%. Those are not really comparable. I want to set minimum. But when you're talking about understanding conceptual information, I put 80% accuracy here because that's going to give you some flexibility in how you're actually implementing it. Maybe you're asking them questions. Maybe it's just a discussion and you are scoring or tallying how many things they're getting correct. So that 80% accuracy, it's because not that it's subjective, but the way that you may be tracking it, even across your different parents that you're working with, could be different. So you are more than welcome to change that to a set number of trials if you have a set way that you're teaching this. But that's why those have a percentage of accuracy versus something that is much more concrete. I want to see the usage of negative reinforcement is going to be 4 out of 5 trials because that is more clear cut. You know there is an instance and they either did it or they didn't do it. And this is how many instances you want to see as opposed to a percentage of some random amount, which could change over each parent training session. But again, you can make adjustments based off of whatever works for you. And then another example that we're looking at here is grooming and hygiene. So we're looking here that the parent is able to understand how to use ABA procedures to guide the client through at least 3 age-appropriate grooming hygiene tasks without prompting from the BCBA. And here we're looking at the parent will guide the client through 3 grooming hygiene tasks using the client-specific prompt levels in 80% with 80% accuracy across 3 consecutive parent training sessions. So here you are actually looking at mastery of 3 targets, and that each of those 3 targets, it should be done with 80% accuracy. So maybe thinking of a task analysis that they can do at least 80% of that without you prompting them across 3 different trials. So just like if you have a goal for a client that they'll tack to 20 common objects with 80% accuracy, you're not like reporting percentage in your report. You're not going to say they're at 80% because 80% of what? Like 80% of the number of targets, or their average percentage is 80%. What you're typically reporting in that sort of situation is that they've mastered 15 out of 20 targets. And of course, they've mastered them with that 80% accuracy. Kind of the same thing here, where you're looking at the number of targets. So you're going to look at, parents at 1 out of 3 tasks they've mastered. And then when they're done, they've mastered 3 out of 3 tasks with 80% accuracy or higher. And that's a different way that you can collect data on this one. So the way you're collecting data, again, you can change it to whatever makes sense for you, but that's how the goals were written, with keeping that in mind to make sure it's something that can be utilized across many different families with different teaching strategies. And then one other one that we're going to look at is behavior reduction. So we're looking at the area of topography. What does a behavior look like? The mastery criteria here is that they will demonstrate understanding of the concept and is able to apply the concept to a variety of provided examples. So here, parent will define topography and respond correctly to examples provided without prompting with 80% accuracy across 3 consecutive parent training sessions. Again, it's that percentage because how you are looking at this with them could be different across different families. Oh, and then one final one. Sorry, I thought that was the last one. Parent behavior. So parental burnout, one of honestly the favorite one that I've added because I have known of it for a long time. Never actually assessed or targeted this with my families, but it's definitely something we should be doing. The mastery criteria here is that they can list at least 5 symptoms of parental burnout and has a method for identifying their potential burnout, such as journaling, therapy, doing the working parent burnout scale, any of those things, whatever works for them. And then the goal is that they will list 5 symptoms of parental burnout and confirm they have a method for identifying their symptoms without prompting with 80% accuracy across 3 consecutive parent training sessions. So data collection. Data collection on parent goals, at least how I felt before I started creating this and utilizing it, especially when I was a new BCBA and didn't really have the guidance in parent training, is that it really felt more subjective than client data. And it does feel more subjective sometimes because parents' progress can involve both conceptual understanding and applied skills. So, like, how do you parse that out? And yes, we are using clinical judgment, so it's not like we're guessing a percentage, but it does feel like it's less straightforward than client data where we're doing plus and minus and duration and have very objective measurements. So, although there are some subjective elements that might arise, having a structured approach to data collection can really enhance the reliability and consistency and also just make us feel better about our parent data as well. So we want to define clear, observable criteria for each goal. So those goals that we just went over, break down the conceptual and applied goals into specific measurable components. So an example, a conceptual goal that parent can verbalize 3 functions of behavior. An applied goal, parent can demonstrate using the ABC model during role play scenarios. So we want to make sure we know what it is that we are looking at. And now I can't write this assessment for the way specifically that I would do everything. That's why some of those things are general, because the way I might teach functions of the behavior could be a little bit different than how you can. So as you're utilizing this, just think about how you're going to utilize it and how you're going to collect the data so you can have something that fits into this goal and is specific and measurable. You can also use structured rating scales, which is going to be like your own usage. You're not necessarily, again, going to hand it to a parent. But as you're doing these, you might want to use a rubric to score understanding based on accuracy and completeness. So they either have no knowledge, partial understanding, full understanding. And for different concepts, you could even write out what those different things are. And then you could utilize that across parents. For applied knowledge, you can rate performance using defined criteria for correct execution during practice. So role play versus real life situations, and incorporate multiple methods of assessment. So direct observation, evaluate how the parents are implementing these skills during session or in real life context. Self-report, you can have parents complete checklists or journals or write notes to capture their reflections on applying these skills. And also role play scenarios. So simulate situations to assess both their knowledge and their application in a controlled setting where you can stop, explain something to them, ask them a question, have them explain something to you, and that would be really useful as well. So next, we're going to go over report writing because we have all of these really great tools now. We want to be able to put this into our report to track that data and demonstrate it to insurance. So I'm going to hop out of this PowerPoint real quick and into the actual Word document of the report so you can see how this can be utilized in your report writing. You can copy and paste this script, fill in the blanks, and report this progress for an initial assessment and reassessment. So let's take a look at a sample initial and reassessment report. So I'm just going to go over a very basic client example. So let's say that we have a 4-year-old client who's newly diagnosed with autism, no prior ABA experience, and they are minimally verbal but can point to request items. They attend a half-day preschool program and have an interest in peers but do not interact regularly. The client is toilet training and does not have any picky eating concerns, but requires parents to complete most daily living routines for them, and they are compliant with parent assistance. And the client engages in some minor task refusal with behavior such as yelling or pushing items off the table. So again, this is a very brief snapshot of a potential client, not all the additional information that you would get from doing an assessment, observation, parent interview, all of that. But we can take this very basic information and kind of put this into a potential initial assessment using the PABC to see what it is that looks like. So this script here, you will see when you get the PABC, it's in the book, but if you go to my website, you can get access to this as well. So you can just copy and paste and edit it into your report. I'm not going to read through the whole thing, but basically this first paragraph here is just going over what is the PABC. So you'd want to, again, copy this whole thing, put it into your report, so you can have the explanation of what the assessment is to your funders, and then the specific information for your client. And then it also, in the second paragraph here, is going to go over what is contained in the PABC. So 107 different items across 9 domains, and then also how it's scored. So somebody that is reading your assessment can read this, look at the graph that you are including, that grid that you fill out, and understand what these are. And then for this third paragraph is where we get into the specific information for your client. So this part I'll read through. So the client's mother, Maria Smith, was assessed using 59 items of the PABC across 7 domains, because again, you're not going to assess them with everything. And those 7 domains you're going to list out here. In this case, that includes autism, applied behavior analysis, skill acquisition concepts, daily living skills, social skills, behavior reduction, and parent behavior. The results of this current assessment, as shown in the grid below, indicates a score of 28 out of a possible 118, or 23.7%. Strengths recognized by this assessment, and you're going to just individualize this for whatever strengths are that you saw on your assessment. But here it includes understanding of their child's autism diagnosis and of autism in general, a basic understanding of applied behavior analysis, and an initiation of some parent behavior which will benefit the parent's ability to access community supports and potentially improve their overall mental health. As the client is newly diagnosed and this is their first experience with ABA, several items were not assessed and most other areas on the assessment were scored at 0. However, the parent is eager to learn and start applying the skills in the home. So with all of that information, then you can see this in the actual grid. So the first color that we're utilizing here is green, so you can see the areas that they scored well on. The areas that were not assessed are grayed out with those lines going through it. So you can see that those were just not included, and then the areas that are left blank were actually assessed and scored as zeros. Then here, when we're looking at our goals, so this is not something that's included in the report template, it's just something for you. So while the parent's goals selected for each of these sample reports would be dependent on the client's treatment plan, behavioral needs, all of those things, what's important for the family, this is just an example of what sorts of goals that you might include for this report. So the initial goals selected are likely going to focus on on increasing the parents' skills in basic ABA concepts like reinforcement, using a token system, following through with instructions, as well as some goals for parent behavior to ensure that the mother is not neglecting her own mental health or need for support with all of this new information and increased time commitments coming at her. I'd also include some goals from the verbal behavior section, even though it was not assessed during the initial assessment, because the client's treatment plan is likely going to focus heavily on increasing verbal behavior, and the parent is going to need to carry it over outside of therapy. And even though it's unlikely that you can test every item during an initial assessment with a family that you're not familiar with, and also you're usually not going to want to do that because it's going to be too much. If having untested items is a concern to you, you can briefly assess whether the parent has any knowledge of those concepts and then score them as 0. It's highly likely with this parent, since they've never had any experience with ABA in the past, that all unassessed areas would be scored as a 0. So you can do that by asking more general questions if you want to have your score out of the full assessment to get that, I guess, like, not necessarily more accurate percentage, but you're going to see a higher percentage of change from scoring at baseline if you open it up to the entire assessment. So that is completely up to you whether you choose to like gray out some of the assessment that's not tested or ask some general questions to identify, do they have any skills in these areas, and then mark them as 0. And then although the client has some deficits in social skills and daily living skills and some behavioral concerns, none of them are severe enough to include those as parent goals in the initial goal selection, again, unless the family specified otherwise. So I would really focus on just teaching those skills that the parent can start using in the home right away, allowing them to see some improvements in their daily life. That's going to help build trust and get more buy-in to the therapy process. And then if time allowed, I'd also include 1 or 2 goals from the autism domain and the applied behavior analysis domain to start building some of those foundational concepts. But again, it's all going to be dependent on just like much more information that you would get from a real client. Also what your time is that you have with the parents as you're working with them. Now for a reassessment, again, the first 2 paragraphs here are just information about the assessment and about the scoring. And then the last paragraph is where we're filling in more information. So here it says that the mother was reassessed using 107 items. So this reassessment, all of the items were utilized. So that's going to be across 9 domains, and that's all of them listed here. The results of the current assessment, as shown in the grid below, indicate a score of 60 out of a possible 112. And that's going to be 28.3%, which is an increase by 4.6% since the initial assessment on that previous date, also January 1st, 2023, or whatever that is. And then over the last authorization period here, instead of labeling strengths that you did in your initial assessment, you're going to talk about the progress that the parent has made. So in this case, it's going to be the understanding of some concepts related to autism and ABA. They've been able to understand and correctly implement skill acquisition concepts, including positive reinforcement and token systems. And they've strengthened their skills and understanding related to verbal behavior, including verbal operant understanding, implementing man training procedures with the client. And then what you're going to work on in this next authorization. So next authorization period is going to focus on building skills to further develop their use of verbal behavior, reduction of challenging behaviors, and improving shaping daily living skills to become more independent. And then that grid is going to look like this. So as you can see, we've opened up some of those more areas. Everything has been assessed except for DL4, which just wasn't applicable to the client. And then the purple is going to be this second assessment where you can see that they are continuing to grow their skills and start filling this out more and more. Now, all of those areas that are purple that the parent is starting to understand, it doesn't mean that you even specifically had a goal for some of those things, but just by the client being in therapy, the parent hopefully seeing some of it, they could be picking up on more of these concepts the more they learn and see and understand what we're doing in ABA, even though each of these purple areas were not necessarily a goal that you worked on, they can still pick up those skills. And then as you go along, you're just going to continue to use this reevaluation template and continue to fill out this visual grid each time that you do an assessment to demonstrate the parent's skills. And again, you do not have to worry if the parent is going slower than this, or if they're going faster than this, or if they're starting services and they already have years of experience, then this grid is going to look a little bit different. But this is going to give you that visual representation of where they are starting services with you and how they're progressing over time. You get that good visual, the parents get the understanding of skills that they're working on, and insurance sees that the parents are participating and that they are making progress over time in an objective and measurable manner. So you've completed the assessment, you've completed the PABC, you've written your goals, you have put all of this information into your report, submitted into insurance. What do we do now? So I want to talk a little bit about after the assessment. I want to talk about parent education versus parent training, how to implement parent training, and also the future of the PABC. So there's different components of parent training. One of them is going to be the assessment. This is, again, something that maybe you were doing before by updating your parent interview during a reassessment. Now you have the PABC that you can utilize to update the assessment, but that's something you're typically going to do just one time per assessment, which is typically once every 6 months. Another component is progress updates. So this is something you should typically do once per month, where the point of that meeting is to update progress. You're going to review graphs with the parent, look at mastered targets, mastered goals, new goals, progress towards current goals. It's going to be sitting at a table with a computer, looking at the data, looking at the programs. Progress updates are important, but it does not replace parent training. And I know that when you are not feeling confident in parent training, you're not really sure what you should be doing, it's really easy to just turn your parent training into parent progress updates where we're just updating them on progress and not teaching the parents new skills. But it's really important that we don't stop there, that we expand what we're working on to make sure we are doing ongoing parent education is one portion that we should be adding. This is where you are having discussions and education of ABA related concepts, not directly related to the client. It can be mixed into trainings or delivered via handouts or online trainings. That's where maybe you're teaching them about the concept of reinforcement, the concept of shaping, all of those conceptual things that we're looking at on the PABC. That goes into parent education. You're teaching them about this concept related to ABA. And then we have hands-on training, which ideally should be occurring once per week. So this is where you are targeting parent training goals. You're observing the parent, implementing programs with the client, and you're discussing any barriers to carry over. So this is where you are giving them those skills and actually implementing those parent training goals that you've created. Now, education versus training. So parent education, this provides general ABA related information to the parent. It might be applicable to the client, but it doesn't necessarily include hands-on training with the client or even client-specific examples. I can talk to the client about the concept of reinforcement, and I can include some examples of the client, but they should be able to understand it through the training, even if I'm not speaking about their child. It's also easy to provide via handouts or online curriculums or videos. Now, parent training, this provides hands-on training to the parent, client-specific, often conducted with the client or in role-play scenarios. It requires planning and time to provide effective training, and it can significantly improve outcomes from both the parent and clinical perspectives compared to parent education alone. So there's a study, Bears et al., 2015, where they evaluated the efficacy of parent training versus parent education for children with autism and disruptive behaviors. This study included 180 children across 6 centers throughout the U.S. Parent training included 11 core sessions, 2 optional sessions, 2 telephone boosters, 2 home visits. It provided specific strategies to manage disruptive behavior, versus parent education was 12 core sessions, 1 home visit. It provided information about autism, but no behavior management strategies that were specific to the child. So the measures completed by parents included the Aberrant Behavior Checklist Irritability Subscale, Home Situations Questionnaire, Autism Spectrum Disorder, and higher scores indicated increased severity. A 25% reduction indicated clinical improvement. And then measures completed by the clinician, blind to the treatment assignments, they did not know what each family was getting, was the Clinical Global Impression Improvement Scale. So after 24 weeks, the Aberrant Behavior Checklist Irritability Subscale declined by 47.7% for parent training and 31.8% for parent education. The Home Situation Questionnaire declined 55% for parent training, 34.2% for parent education. And again, for both of those, declines are good. You want them to go lower. And then the Clinical Global Impression Improvement Scale was 68.5 for parent training and 39.6 for parent education. So for all of these, parent education obviously does provide some benefit, but it is not comparable to parent training. It is not a replacement for client-specific parent training. So if you find yourself where you're just going through this curriculum, you're just providing parent education, it's not bad. I mean, that's a good thing that we're doing that. It's better than nothing, but it's not as good as actual parent training where you're doing hands-on work, actually getting the parent to carry over these skills that you're working on. So, how do we actually get parents engaged in parent training? I'm going to briefly go over a few steps for it. If you are interested in getting a much deeper understanding of this, I have a masterclass, parent assessment and training, which you can find at abcbehaviortx.com. And if you want to truly dive into the world of parenting and how to work with parents, I actually have a year-long course, which is Parenting Science Institute, Parenting Science Coaching Certification, that is going to go so much more in depth into parent science, how to work with parents exclusively. It is going to level up your parent training exponentially, but also give you a certification that you could go out and just do parent coaching on your own with parents of kids with autism, parents of kids that are typically developing, that are having challenging behaviors or skill issues. It's going to give you really amazing skills. And I'll include the link to both of those in this training below. But just to kind of briefly go over how we need to establish this parent training setup. There's a step 0, which is really your preliminary steps. These are things that you ideally have already done through your parent interview and through your soft skills, that you need to build a foundation in your relationship with the parent. So you need to have this rapport built. They need to like and trust you. Just like with our clients, you don't go in just telling them what to do. We need to have this pairing process in place, and we really need to do the same with our parents while still maintaining our professional boundaries. You can conduct the parent assessment, is what you should have already done as well, because we don't want to start intervention without an assessment, not for the client and not for the parents. Identified socially significant parent training goals, and have a plan to teach and train the targeted concepts. And then attendance. We need our parents to actually come to parent meetings. So you should plan your parent training schedule, including progress update meeting, parent education topics or meeting if it's separate, and parent training session meetings and focus. So the reason why I say parent education topics or meeting is because for parent education, like I said, those things can be disseminated through handouts or online trainings or videos. So you don't technically need to have a meeting for them. You could just give it to the parent if they're going to do it, or if you need to have a meeting where you sit down and you actually talk to them about these things, then you can make it a meeting. However, that makes sense. And then you can share this with the parents through a printed calendar or online. I use Google Calendars to share with our parents. Then invite all caregivers that can attend, both parents, grandparents, nannies, anyone that's involved in the client's life, and then send reminders ahead of time, sometimes several reminders, as much as you can do to remind them there are parent meetings coming up. And you also want to make sure that your parent trainings are planned. What are your topics and focus areas? You don't want to just go in and wing it and hope you have something to talk about. You want to use the parent training goals that you determined are needed and socially significant from your assessment. Have your data collection ready so you know what goals you're targeting and what you're taking data on during the training, because we are not estimating data. And go in with a plan of how you're going to train your targeted skills. Now, that's going to get easier the more you do it. You'll know how to do it from having done it previous times already. But if you are just now starting to do it, it may be helpful to actually have a written plan of what you're going to do when you go into this meeting. And then parent education topics should precede parent training so that they have the conceptual knowledge needed to apply the skills accurately. So don't go into a parent training session and ask them to demonstrate using reinforcement when you've not educated them on reinforcement. The education piece needs to come first. And then we have engagement. So we want our parents engaged in what we're talking about. Don't jump into your training the second that you arrive. Remember your soft skills. Take a few minutes to build rapport. Get updates or progress on the parent and client skills since the last time. Ask for feedback. Are they happy with how things are going? Provide any additional parent education on the session's focus and answer any questions from the parents. And then learning. We want them to be able to actually get this information, learn it, utilize it when we're not there. So behavioral skills training is a really good way to do this. It has multiple steps. You're going to first start with instructions, which should be clear, concise, verbal, and written. Modeling, you're going to demonstrate the skill yourself. Rehearsal, so practice this skill in role play or with the client if that's appropriate. And then feedback, provide immediate and detailed feedback, and then cycle it again. Go back to modeling, rerun it, get the improvement until they're able to master this skill, and you don't really have any corrective feedback. The BST cycle might not be completed in one training session. They're not necessarily going to get it in that 1 hour that you're there working with them. This may be something that you're going to need to target over several sessions, and that's okay. Parents should also observe qualified RBTs or BCBAs implementing these targeted skills or procedures throughout regular therapy sessions. So hopefully you have RBTs that are really competent in doing this, but maybe they're not comfortable with a parent watching them, or maybe you're still training them on it. So identify who is going to be like the lead RBT on the case that the parent should come and observe when they're working with their child. Obviously, that is much easier in an in-home setting, but if you're in a clinic setting, hopefully you can still do it there through either having the parent come in or even recording what the RBT is doing and then sending that to the parents to review. And then also role play the skills with the BCBA prior to implementing it with the client. Even though role playing can feel awkward at times, it is going to help the parent identify any areas that are difficult, and also it's going to help them get more comfortable with it besides doing it with the client when there may be unexpected events that occur. You also want to make sure you're breaking skills down into smaller steps through a task analysis and teach each step on its own. Keep your feedback positive, so verbally praise the good things you saw, and keep corrective feedback to 1 to 2 issues to focus on at a time, even if maybe there's like 10 things that need to be fixed. Don't tell those to the parents all at once. That's overwhelming and it's going to make them feel like they're not doing a good job. We want to keep it positive and we want to keep them motivated. So 1 to 2 issues at a time. If it makes you feel better, just like have a notebook and write all the other things down. Just don't have them all come out of your mouth at one time. And then check that the skill is generalizing to real life situations and that it's maintaining over time. So that is just, again, a brief way that we can engage parents in parent trainings and things that we should be utilizing to teach them these skills. Now, I also want to talk about the future of the PABC. Like I said, this is the only parent assessment for our field, and I think there is so much that we could do with this. So one area that I hope to include is advancing technology. So currently the PABC is available, of course, in a book format, and also in an electronic format for you to be able to see and utilize. But I would like to develop this into a full electronic scoring system that can automate scoring and data visualization, streamline goal selection and progress tracking, and reduce time spent on manual data entry, allowing for greater focus on intervention. So that is something that is on the list. If you know how to do that, please email me, because that is something that I'm certainly looking forward to, because that is something that I think will make it a lot easier for us to implement and utilize across all of our clients. I'd also like to see this established field-wide. So having this consistency across our field, one, it's going to be great for parents because we're going to be providing better parent training, but it's going to help with collaboration across providers. So it's going to promote the use of the ABC as a standardized tool for assessing and reporting parent skills. It's going to facilitate a shared understanding and communication across companies, fostering collaboration. And it's also going to help with insurance. If they start seeing this more and more, and we're using this as an objective way to show progress across time that's measurable and objective, that's going to give us a lot more backing to our therapy and the hours that we're requiring and demonstrate that we are seeing progress. It's also going to help support advocacy efforts by showcasing the tool's value in meeting payer requirements. So insurance oftentimes is looking for a way to say that we're not necessarily doing the things we should, or reduce hours, or unfortunately just not pay for services. And having this is going to be a really valuable tool to show that you're meeting these requirements, especially when it comes to parent training. And then finally, expanding assessment reach. So this assessment is the parent assessment of behavioral concepts, but I believe that this would be useful for other areas as well. One primary one that comes to mind is teachers. So to be able to assess classroom implementations of behavior support strategies, or other caregivers, other people that are in the client's lives, to assess these behavioral concepts and make sure that what we're looking at and what we're trying to program for our clients can be expanded to all areas of their lives. It's going to help us with a broader impact. It's going to enhance the PABC's ability to drive meaningful progress across various stakeholder groups in a client's life. Now, feedback and collaboration is always so important to me. Your feedback is very important to making the PABC an effective tool for the field of ABA. And I'm also, as I said, always open to collaboration. If you have ideas or know how to make anything on this better, things to add, things that you would like to see expanded upon, please reach out to me. I'm always open to hearing from others in this field that are just as passionate about this as I am. You can reach out to me at mdruskus@abcbehaviortraining.com or on my website at abcbehaviortx.com. Thank you so much for joining me today, and I hope you have a great understanding of the PABC and are very excited to start using it with your families.